everybody. Welcome back to the Optimization Academy. I am honored and privileged to have Dr. Bautista back here for part 2 of Optimizing Your Testosterone. We went over Dr. Bautista's bio. He's an amazing human being, not just an amazing doctor, but an amazing human overall for some of the work he is doing in the community and continues to do and plans on doing. But for now, we'll talk about Dr. Bautista being living in Fresno, California, having 2 clinics out there, specializing in men's health, nutrition, testosterone, PRP, varicose veins, peptides, stem cells, you name it, he does it. All the things to help you feel better. And we're honored to have him on the show for part 2. So welcome back, Dr. Bautista.
Thanks for having me, man. And sorry, guys, I know I talk a lot, so I can start, my nurses knock on my door because they're like, hey, get out, you're done, you've been there too long.
Well, there's another option. You could be here and it could be boring. We could just be like staring at the screen. You give me 5-word answers. I'm like, all right, dude, I got this. I'll carry this. I will need PRP for my lumbars because I'm carrying this podcast. So I'd rather have you doing that. So again, like I told you, man, I'm gonna throw you an alley-oop. You just gotta finish it.
You got it, man.
Gotta finish it. So what we're going to talk about today is, if you listen to part 1, we talked about the ways to optimize your testosterone, specifically not about making your testosterone numbers as high as possible, but recognizing the signs and symptoms if your testosterone is converting into a pathway that can make you feel less great on it, whether that be estrogen or estradiol, whether it be DHT, whether it be excessive hematocrit or hemoglobin, or whether that be, we can talk about LH and FSH, we can talk about all these different things, and we'll also talk about if your testosterone is just way too high, right? If you're, that's the whole thing. It's a guy thing, man. It's like 0.5 feels great, but what will feel better? 2.5. That's just, that's how we think sometimes, right? So that being said, I want to lead off with this, and we were talking about this offline a little bit about when it comes to estrogen, that's where we're going to start, is that we don't have ovaries as men, so we're not making our own estrogen, not directly. We're either going to make it from testosterone or we're going to make it from the environment. So that being said, what are some of the environmental things, I feel like a speech impediment here. So when it comes to that, what are some of the things to watch out for in the environment that may cause your estradiol to be too high?
Right. So I think the term that's out there, and you guys can look for, is the xenoestrogens, right? Xenoestrogens is actually one huge component that I look at. And then the other one is what we talked about, what we get inside through our adipose tissue, right? Aromatization of testosterone to estradiol, but we also get some estrone. And why is that important? So even though I take care of men's health, I'll give a really good analogy of estrone with our overweight women, right? Some of our overweight or obese women, you'll notice that they have irregular periods, right? So it's almost like they don't have a period, then boom, they have a heavy amount of bleeding. And why is that? Because estrogen, right, or estrone on this path from the adipose tissue is almost like a low dose birth control pill. And so what we have is the endometrium is just getting bigger. Now, again, we're talking about women here, and they're not ovulating. Then all of a sudden, boom, it all just dumps down. And sometimes it's not even a real period. It's just a letdown, right? But that low dose estrogen, that estrone, so to speak, is an inflammatory type of estrogen, right? So that's one of the things, that's why it's so important with our body or with our patients to really work on some of that, your peripheral conversion with fat, right? Really working on a visceral fat, really working on your composition, right? We know now that your muscle mass is probably your best metabolic, how would I say this, currency when it comes to burning this stuff. And that's one of the reasons I'm a big fan of testosterone. But you have to be very careful because, again, if you have a lot of adipose tissue, you're going to, again, go ahead and convert to this inflammatory estrogen or estrone. Well, on top of that, you start giving people, and we do a bad job, especially MDs. I'm going to take guilt for this, right? Credit for this, bad credit. We tell patients things like, hey, you need to drink more water. Hey, drink more water. Well, where are they drinking this water from? And this isn't something that I'm making up. This has been published. This is data that's out there. We have our plastic bottled water that has been sitting. Fresno can get about 100-something degrees. That's been sitting in the sun. You got the xenoestrogens now due to chemical reactions that it would take me a while to kind of break those through. I'd have to review my chemistry. But you start having these estrogens because we told the patient, hey man, drink more water, instead of saying, hey, drink water from, doc, I think I saw you with a nice a BPA. There you go. Boom, right? Awesome. BPA free bucks. So decreasing our exposure to some of these estrogens are going to be well. So we talk about plastics being one of them. The other ones is going to be some of these processed foods that we talk about. These processed foods. Now, there's a lot of argument, and again, I'm not, hopefully I don't get anybody to debate here with soy, right? And I'm not against soy. I actually think soy is okay, right? So I'm sure you've heard of a phytoestrogen. However, we're talking about processed soy, right? Processed soy in many people's minds, including mine, just like other processed foods, can be contributing to this excess estrogen that we get into our body. We just have to be very careful as providers, the way we educate people. I'm going to make fun. Well, I won't, because she'll beat me up. A family member of mine, she's kind of one of those that tells me this and that, she's a little bit chubby, and she goes, all I eat is organic, because she was eating organic gummy worms. I'm like, oh my God, there's nothing organic about it. Sugar is sugar. But that's our fault. We have failed as doctors to say, hey, you need to eat more organic, right? So they go and they get organic gummy worms. So when it comes down to the xenoestrogens, the main ones that I'm looking for are things such as, I mainly take care of men, so I'm not going to talk about birth control, but I talk about things like soy, processed soy. I talk things about plastics. And then there's also, there's some, again, I know some of this is debatable, but some meats, the way some of the meats are converted into our body, especially, I'm going to get beat up for saying this again, certain types of poultry that can really estrogenate. You'll see people, young boys with gynecomastia, large areola, things like that. So you really want to be careful on some of this excess exposure as well.
The other thing, you being from Milwaukee, I call it the Midwest swing, man. It's the beer and the beer belly.
Absolutely.
Right? Because, especially the hoppier beers will contain more hops, and hops, from a botanical medicine side is humulus, right? So that's a phytoestrogen, right? So it's going to increase the conversion of estrogen, right? And then also adipose, and you touched on this earlier, is that adipose or fat cells are estrogen generators, right? So, if you are overweight and drinking a bunch of beer and also stress, that is going to contribute to having that higher estrogen, right? So there's certain, and this is great about this, Dr. B, is that we haven't talked anything about DEM or Arimidex or Aromasin. This is just general lifestyle. This is lifestyle, right? And so, and I'm sure there are going to be people watching that's going to be upset, because we're not going to talk about numbers and what medications to take and how to take it and all that. Yeah. But just know that there are supplements that can help with estrogen metabolism. And there are, you can get into DEM, you can get into chrysin, you can talk about these things here. And then there's also the estrogen blockers or the reversible and irreversible aromatase inhibitors and all that. But I think that's a conversation had more so with your provider.
I agree.
Say, hey, my levels are high, I'm feeling this, you run this, what's the strategy to get my levels in that Goldilocks, that green zone, without bottoming me out where I feel like crap. So and that's a conversation that, we're just I'm going to call an audible here, just kind of football back, say, hey, we, just know that there are options out there that can be integrative in nature, but really the focus on, because this is the conversation I don't think people get, is what can I do? Not being dependent on a medication or a supplement, but what can I do? What changes can I make personally to keep this under control?
Right. Absolutely. Even clinically, I say I take care of a lot of varicose veins. Varicose veins I see both in men and women, versus spider veins or telangiectasia, right? I tend to see more in women due to, again, that hormonal effect of estrogen. So you mentioned alcohol, and I'm not saying all people that have this are alcoholics, but you'll notice people that drink alcohol, they'll get a lot of spider veins, we call them telangiectasia, on their nose, a lot of cherry angiomas, little red spots. So those are things that, if you're talking to your loved one and you see it and they're having a drinking problem, you can see that. You can say, wow, man, maybe they are consuming a little bit too much alcohol,
Right. Yep. It is. It's hard to tell them to stop. It's hard, especially not football season. And if you have a team like I do, man, it's like you're like, oh man, I need a drink. Just through another interception. But we'll see how our buddy Fields does this weekend. I'm excited for that.
When I talk about alcohol, I know it's off the subject of testosterone. I tell my patients, right, is us as men, we have to start doing a better job with our stress reduction, right? We tend to say, hey, Dr. Ray, I had a rough day, man, let's go have a beer. Hey, man, I had a rough week, let's go have a beer. But all that's really doing is numbing our wits, right? It's really not a relaxation. We as men need to do a little bit better and say, hey, man, I've had a rough week, let's go to the sauna. Had a rough week, let's go to the gym, let's go on a walk. Those are all ways that we talk about optimizing our testosterone. There was a great article from Harvard. Harvard's, they have this cool health journal, and it showed doing yoga twice a week raises your testosterone. Isn't that crazy? And do we really think it has to do with yoga, or is it the relaxation, the recovery? Those are all things as men. We're talking about optimizing your testosterone. Optimize testosterone. A lot of it, and not all of it necessarily comes in a pill, right? We talked about foods, certain foods out there. We know now that foods that are high in zinc, right? Foods that are high in selenium, things such as almonds. I'm a huge fan of Brazilian nuts. Those are all natural aromatase inhibitors, so to speak, but also help protect your prostate. So those are all things. Are we contributing? Are we including those in our diet, right? Instead of saying I love almonds, are we eating those healthy fats every day?
Perfect. Yeah, and that's just it. I thought about when you were mentioning the stress, the yoga article. First thing I thought was like, man, that's probably doing wonders for their cortisol. Wonders for it.
Yeah.
And so of course, down the pathways, you're going to get better testosterone. Now, something we brought up in part 1 was the conversion of testosterone to dihydrotestosterone, or DHT, which leads to some of the symptoms of acne and oily skin and hair loss. And sometimes there could be some BPH or benign prostatic hyperplasia. So that being said, if you note the symptoms, check the labs, and you see the DHT is a little high, what are some strategies that are available that you use to bring that under control or into balance?
Right. Well, I think one of the things obviously is everybody is, we're all the same under God's eyes, but we're all a little bit different. And there's also different types of testosterone. And there's some people that just respond a little bit different to different testosterones. Examples, there's cypionate is probably the most readily prescribed testosterone, not because it's better, it's just more readily available. You can get it at your local pharmacy, whatnot. But there's propionate, there's enanthanate, there's different types that people can take, maybe if they're having a side effect to one. That's one thought process of it. Because if you read your books, it's just going to say lower the dose, right? And everybody's like, oh, but I feel great, doc. It's just this darn acne, right? Other things that people fear is the medication. I won't get too descriptive on it, but the medication finasteride, which is a DHT blocker. Again, it's about balance. And I think people worry, they hear that, taking a DHT blocker is going to give them impotence, low libido, and it definitely can. And that's usually seen at the high dose, the 5 milligram dose, that is for your prostate, right? There's a lower dose that I mentioned earlier, 1 milligram dose used for your hair. For some people, that might be what's right for them, right? But again, there's other natural things that can help decrease that conversion. Zinc is a great one. Magnesium, more than just cramps at night and sleeping well, can definitely help as well. But I think a lot of times when I look at that, I actually look at nutrition. I really wish I was trained more as a naturopath, so I could learn more of our Earth's herbs and healing mechanisms, because I have noticed that when these guys start talking about this acne, when a lot of it start looking at their nutrition, and you'll see, even though they think they're eating healthy, they're eating processed healthy food. So a lot of maybe protein powders that are just a little bit inflammatory for them, right? I always say, if you get I won't say which bar so we don't get sued. If you get a nutritious, healthy bar and you put it right on the desk, well, that bar is going to stick there for 2 days, 3 days, 6 months without moving, right? Think what it does to our gut, right? Versus an apple. We bite an apple, we put it on that counter, right? It starts to turn brown after a couple of minutes, starts to wither up a couple of hours. A couple of days later, it's just a darn a core, right? So those are all things that I try to contribute to. And we just have to be honest with ourselves. Hey, man, let's get our food in a food diary, man. Let's see if you're eating anything that's contributing to that. As a matter of fact, a lot of dermatologists, good buddies of mine, when they see acne, they don't just necessarily go to doxycycline or an antibiotic. A lot of them give metformin. Isn't that amazing? For hyperinsulinemia, right? They'll give metformin for acne. What does that say about your nutrition? Hyperinsulinemic, man, right? And much like the family member I was making fun of, I have another one that's a vegetarian. I say, even a rabbit will get fat in a garden, right? You give a rabbit a whole bunch of potatoes, they're going to eat them, they're going to get chubby. So it's not necessarily just that meat's bad or this and that. No, it's too much of anything, right?
So good thing you mentioned about wanting to know more about the natural side. Good thing is naturopath. I'm not saying the best one out there. I do okay.
Yeah.
That being said, when I do see elevated DHT and I see the symptoms, some of the things I'll consider, and it depends on how high the DHT is and how they respond to some of the natural stuff, because I prescribe dutasteride and finasteride, but only for a short period of time. I don't think that's something I want to keep my patients on if I can help it. But we do really well with saw palmetto. We do very good with urticadiolcia. We do really well with lycopene. We do very well with glycine, arginine, and glutamine. So we do really well to manage that. So it may be, let's use the medication very temporarily just to kind of help with the acne or some of the symptoms. But I want to make sure we establish the foundation of giving what the prostate needs to basically prevent it from enlarging from the conversion of testosterone to DHT, because everyone's different. Some people just produce a ton of 5-alpha reductase, it is what it just, the cards were dealt. They were dealt, man, but we look at the environmental stuff, but sometimes it can just be genetic in nature as well. And so we keep an eye on all that stuff. And I'm glad that we can it's great that we have access to be able to tailor our treatment to the patient.
Right.
That's the beauty of this medicine,
That's the beauty of this medicine. I think what's awesome too is, incorporating everybody's, if everybody had a quarterback for every position, you wouldn't have a running back, right? I think it's great that you have different people like naturopaths, everybody that brings a little bit. When I was in Cuba, I remember a person that had a laceration, I sutured him up. So over there, the physician, the naturopath, and the chiropractor, they're all together. It's not seen like, oh, there's a different specialty. So I remember suturing up a patient, and then the naturopathic doctor put guava leaves on the wound. And I was like, oh man, that was pretty cool, right? And that's a perfect example, what you educated me on right now of saw palmetto, right? Yeah, I've heard of it. But the other thing is, me as in my training, the next thing is where do you get that? You just go to your grocery store. A good naturopath or someone that's really invested in this will have great companies that they can recommend with quality products. And I think that's another thing, for the patients that are listening out here, is finding someone that's a team, someone that can say, hey, I'm telling you right now, I don't have all the answers, but guess what? My buddy, Dr. Greg, might be able to help out with this, right? Because I am limited in my education in that it is an allopathic approach, MD approach, right? So we see elevated this, we give finasteride and we give it to the cows come on. And then you're absolutely right. Where I've learned to give it short term, whether we're talking 6 to 8 weeks, whether we're talking to someone who's protocol, I've learned it from talking to doctors like yourself.
I appreciate that.
Yeah,
we're here, man. I like that we can have that integrative approach and a functional approach and get our patients better. So last on the list for today, and this I think is very important, and we've kind of touched on it in part 1 and part 2, is that concept of, hey, if a little bit of testosterone is good, a lot must be great. And I don't want to go to a doctor. I got my buddy with the trench coat over there, and also I have the internet. So there is something to be said and to be discussed about super physiological or too high of testosterone and getting the anabolic steroids, let's call them what they are, and not knowing how to use them and getting them from unpure sources. And it's not just that, it's the fallout, right? It's because these things are going to affect your hormonal pathways. They're going to affect your hypothalamus. They're going to affect all these things, right? And we get guys in that they've done excessive testosterone. They've done, massive amounts of DECA or all the masterons, all these different things. And now we want to get them better. So I would love to. This one, I'm just going to pass the ball and let you run with it, because this is something I know we wanted to talk about and that you want to talk about. So let's get into it.
Absolutely. And I get a lot of those patients as well. And so the problem, other than legalities, right? Talking about, hey, tren is illegal, right? And you want to make sure that you're checking your labs and all that. What does it do to your body? What do I see? Right. So the first one, you hit it right on the spot. So we all know that testosterone, all we talk about increased libido, muscle mass, all this, but it also shuts off your natural testosterone. It says, hey, especially when we talk about tren that's so potent. So what happens is when patients get off of tren and these massive doses, their bodies literally shut down. And what makes that very difficult is for someone like myself to put them on what people call a post cycle, right? Whether we decide to use human chorionic gonadotropin or whether we try to use Clomid, whatever we decide to use, makes it very difficult because of these massive doses. It's almost like a brake that has been put on. And other than that, other than the hepatomegalys, other than the, what's it called? Cardiomegaly, big heart, right? Because remember, a lot of these are bovine testosterones or equine, which is for horses, right? That's what you really have to be careful for, because this is what we're trying to do with our patients is not only improve longevity, but the quality of life, right? As we get older, aging gracefully and aging comfortably. So yeah, you're looking good, you look jacked, but you're increasing your risk for heart failure, right? You're increasing your risk for stroke, for crazy polycythemia that we can't manage with regular therapeutic phlebotomy because you're on a testosterone that's 50 times more potent than testosterone cypionate. So I think that's the one thing that you have to look for. And then also just have a basic understanding as we get going, right? We a lot of us have kids, right? We have kids. I have 4 boys, and I always tell them, would you let your son take something off the street that they didn't know that? You'd be like, absolutely not. That's called a drug, right? Then why should we do that? But at the same time, as physicians, I'm very understanding, and I explain myself. This is why. There is no data that shows that performance, right? Let's just talk about weightlifting, is any better with a testosterone of 4,000 than it is with 1,200, than it is with 1,000, than it is with 900. That's the thing. What people are looking for, whether it's getting bigger, getting strong, getting faster, has nothing to do with the dose of testosterone, right? It all has to do with your hard work and your performance in the gym and in recovery. That's the main thing. So I think that's the first thing. When I see people in these massive doses, I don't shut them off, right? Regular clinic, I know some doctors do, I'm not saying I blame them if I do, but if I get someone that comes to me and they test positive for fentanyl, right? Or they test positive for a drug like meth, I don't punch them out of the clinic. I don't say, oh, I'm going to pass my problem to Dr. Greg. No, they're not going to get certain medications from me. I'm going to educate them. That's what my job is to do. And that's what I would hope from practitioners. If you have someone that is taking Tren or that is taking Winstrol, right, or something, why are they taking that? Is it because they're fatigued and we haven't attacked their chronic fatigue or their adrenal fatigue or their low B12? That's our job as clinicians, man. We got to give ourselves that opportunity to educate these people. And I think once you build that trust with that patient and you let them know there's really nothing good that comes out of this on that high of doses, right? Dr. Gray, if I'm on call, I hope you'd give me a cup of coffee, not cocaine, right? And then I hope you say, Dr. B, go get some sleep, right? That's the main thing. That's what we need to do with our patients. If these guys are trying to, if they're tired, we shouldn't be giving them Tren, right? We should be maximizing their cellular optimization and then giving them testosterone in proper dosages.
And that's great. They said that, and I think that's one of the most important pieces that you've hit on in that part of it, is that the rapport, that trust we have with our patients is like, hey, I don't care what you were, like I care because we need to get you right, but I'm not going to sit here and judge you and say, hey, you did this for 2 or 3 years. Yeah. But they're here for a reason. They're probably not in our office because they want to keep going. They're there because I have these side effects. I want to feel better. Let's get right.
Right. Right.
So what can you do to, they still want the athletic, they still want fitness, right? They still want the body composition, the libido, all the things that testosterone provides, but they know something is off. Yeah. You're dealing with gyno, you're dealing with, very intense nipple sensitivity or tenderness, the bloating, you're dealing with all that, the libido, erectile function is gone. Yeah. And they're here to see us for a reason, because they may not have felt comfortable having that conversation with their insurance provider. Nothing against insurance provider, primary care providers. It's just they don't feel comfortable for whatever reason. And so that's great that we don't shut the door and kick them out and say, hey, you're doing that. I'm not the guy or the gal to help you. We're there to help and to optimize their health and make sure they live the rest of their life in a healthy, optimal way. Right. And that's really what it is. Yeah. To me.
Like the other one that you see a lot is oxandrolone, right? Or Anavar, right? Anavar, some people have some great benefits, right? A lot of people like it. It has more anabolic properties and less androgenic properties. But that's another thing, right? I've seen people that have been on Anavar from the streets for 2-3 years, they're just pretty much knocked out their adrenal support, right? And the other thing is you'll see their liver enzymes elevated. We don't know what's in that capsule, right? So when someone says, hey, this is what I'm taking, I really don't know. I'm not a chemist. I can't break that down. I don't have a chemistry lab where I can find out through spectrometry what chemicals are in there, right? So I think it's good to build a rapport and just say, hey, man, let's give me a try. Give me a try of doing it the right way. And I guarantee not only will you get good results, but you're going to feel better because we're going to track it in a holistic approach versus pumping that for that. I think I used the analogy that the NASCAR. That NASCAR, man, when it pulls over, first takes a pit stop, right, recovery, but they don't just pump it full of testosterone or fuel. Man, they fix those tires, transmission. It's a NASCAR, man. And that's what our body is too.
So, man, as they say, all good things must come to an end. And so our good thing here is coming to an end. I want to say thank you, Dr. Bautista, for making time for this, for sharing your knowledge here. And, this was an honor for me, and I hope my guests have learned a lot from you. So I'm sorry, man, I was literally about to just go straight to the transition right there. So, hey, man, thanks. I really appreciate this. So.
Oh, man, thank you. Thanks for having me on. I can't wait to do some more, man.
Okay. And for those who did not listen to part 1, where can we find you?
I'm pretty much just on social media at Dr. B Fit MD. I spell it doctor. And a little bit of Facebook as well, mainly Instagram. And my website is drbfitmd.com. I'll be honest, I don't update it much, but get a hold of me and, maybe we can make some happen. And I really look forward, man, to continue to work with you and and keep taking care of the patients, because I'm humble enough to know that I don't know everything. And I know that a team approach is better. I would love to have someone like you on my side where I could have a naturopathic approach, someone that's actually about that life, working out, so we can do what we're here to do, which is help people. So thanks, man.
Sign me up. Sign me up, man. So I appreciate you. Appreciate your time once again. Be on the lookout. This episode will be on YouTube, on podcasts, on Apple Podcasts and Spotify and all different places you can find it. I am personally inviting him, putting him on the spot to come back and have another talk. I want to talk more about PRP. I want to talk about varicose veins. I want to talk. I have so many things to talk to you about, man. Peptides. So we're going to have you back. So
awesome, man. You got it, man. We'll talk soon.
Open invitation, my friend. Open invitation.
Thank you.
All right, thanks, guys. And we'll talk to you soon.